What are the signs that parents should be looking for, both behavioral and also physical signs?
Well, oftentimes we'll hear that their child spends a lot of time on the internet researching clean eating or looking up recipes for large amounts of time. Like Phyllis said, they may become a vegetarian, or they may just decide to cut out fats or carbohydrates almost completely from their diet. A lot of times those kids will start over-exercising, so they'll exercise for hours a day, 7 days a week, or they'll exercise multiple times throughout the day. Other behaviors they may do at home that parents may notice at the dinner table is they cut their food into small bites, they push it around the plate rather than actually eating it. They may hide the food under a napkin or feed it to the dog.
Another behavior you might see in there is that they will not allow the one food to touch another food. Like it has to be in their own little category. And then the pattern that they may eat is they may eat all of one thing, like they may eat all their meat and then all their protein, if they eat it, all their meat, all their starch, all their fruit. They won't eat it like normal people do, where you eat take a bite of one thing and a bite of another. It's all inclusive. They eat one category completely.
What kind of, obviously aside from, I'm assuming, weight loss, would be the physical changes that a parent might observe in their child?
Well, some of the complaints that kids may bring to their parents is that just general abdominal pain. Their stomach doesn't feel good. They could develop reflux. They might feel bloated because when you're not eating enough, your intestines don't work as well, so they may develop bloating or constipation. They may feel cold all the time. They may experience dizziness, passing out. And a lot of times we hear parents say that my child's personality has really changed when they developed this eating disorder. They used to be happy, they used to have friends or take an interest in other things, and now they don't do the things they used to do, and they're sad and withdrawn or argumentative.
And a major one is if the girl's having her periods, she will lose her period, and very often that's the first thing that gets them into the medical care. They'll take them in because all of a sudden she's stopped bleeding. So that's a big one for them.
And this does usually disproportionately affect younger girls as opposed to boys.
It's about 20% boys, 80% female.
Would the signs, obviously other than menstruation, be similar in boys as they would be in girls?
The signs are similar, and the boys may have some muscle wasting, so they may lose some muscle mass because of the weight loss as well. Sometimes the boys present to us a little bit later and are a little bit sicker because they don't get recognized as early as the girls do.
Let's talk a little bit about bulimia. Those signs and symptoms and behavioral changes, what should parents be looking out for?
So with bulimia, there has to be an element of binge eating, and that's somewhat poorly defined, but they have to eat a larger amount than normal in a defined period of time. So parents may notice that the food is missing from their cabinets at a higher rate than they would have expected, and they also may notice signs of vomiting, usually in the bathroom, or kids may leave the table in the middle of a meal or right after a meal to engage in vomiting behaviors.
And the vomit, sometimes they'll go out and vomit outside. They may put it in little baggies and throw it away. They may vomit in the shower, anything to hide it because they're not proud of it. And this binge eating is very subjective, because if you have somebody that is well into the disease, the binge may actually be very small, but they identify it as a binge, or it could be very large.
Does this come from the same place of maybe starting to want to look healthy or want to diet, or is it motivated by sort of a different underlying issue?
It can be both. There's a different personality generally in a bulimic than there is in a anorexic. An anorexic generally is more OCD type, very tightly wound, whereas the bulimic is more loose. They tend to get into more of the other types of issues of drugs or alcohol. You see that more in the bulimics than you do in the anorexics. So it's a different personality type.
I would also say that it is often driven by the desire to look thinner, and oftentimes what the bulimics will do is they'll skip several meals throughout the day, and then they're so hungry that they develop that sort of out of control binging. And the really important thing in a binge is that the patient has to feel like they're out of control when they're doing it, whether it's truly a smaller amount of food or really a large amount of food. They have to feel that they don't have any control over what they're eating.
And typically a bulimic is either normal weight or just slightly overweight.
Is there anything other than obviously the signs of getting up from dinner, or you actually catch them in the act of vomiting?
Sure. Sometimes dentists will actually find bulimics because they'll notice the tooth decay from the acid. They also can develop pretty bad heartburn or reflux because of the repeated vomiting. They may start to vomit blood because they've been doing it so much. Bulimics that engage in laxative abuse will have diarrhea, but they also may develop some rebound constipation when they are not taking their laxatives. So those are some signs to look for.
And a lot of abdominal complaints, a lot of cramping, especially when they're doing the laxatives.
Is the energy level about the same? Are they still very fatigued?
Depends on what kind of behaviors and how much of it they're engaging in. If they're doing a lot of laxative use and a lot of purging, yeah, the fatigue level is very, very high.
And is this about the same for boys and girls as anorexia would be, where you have a much smaller percentage of young men?
Correct. Boys that are at higher risk for the eating disorders would be like boys that are involved in wrestling or in activities that tend to be more weight or shape focused.
Another disorder we talked about earlier is binge eating disorder. What differentiates binge eating disorder from bulimia?
There is no purging in a binge eater. These are people that just will eat huge amounts at one setting, and oftentimes a binge is usually once or twice a day. People say, what's the difference between binge eating and overeaters? And overeaters is a continual thing all day long, whereas the binge eaters have discrete times where they sit down and eat huge amounts of foods. And they are overweight. And the other thing that parents will find with the binge eaters is look under the beds, because that's where they put all the wrappers or all the pieces of food that are not eaten, or the dishes. So they hide oftentimes they hide the stuff underneath their beds.
Can we talk a little bit about ARFID? And I know that's one of the newer disorders.
ARFID is much easier for parents to recognize because it usually is stressful for the whole family. So I have patients who will only eat a certain food or a certain few foods. They won't expand their diet at all. They may not be growing well, or it may impact them socially, where as they get older, it's hard for them to go out in social situations and hang out with their friends because their eating is so strange and different from everybody else.
Or they may say, I can't eat at a restaurant because I've seen dirty stuff, and it gets more narrowed down where they will only let their family go out to one or two restaurants in town. So it does impact on the family very strongly. So that's very easy to identify.
And so that might stem less from a place of vanity and more almost from like an obsessive compulsive?
Yeah, there's no body image issues in the ARFID patient, but they restrict their food for other reasons. So sometimes you'll get a kid who's has a food allergy, and then they're just afraid to eat after that. They sort of generalize it to all foods. Or a child may have had a choking episode, so they're afraid to eat because they're afraid they're going to choke again.